Welcome back to Healthy Living. We're talking comprehensive pediatrics today. We've talked with Cindy Ingram, Director of Women's and Children's Care at St. Tammany Parish Hospital. And next we'll talk with Melissa O'Malley, Assistant Vice President at Ochsner Health System, responsible for pediatrics in West St. Tammany. Good morning, Melissa. Glad you're with us.
Thanks for having me. I'm happy to be here.
Super. Well, talk a little bit with us about Ochsner Hospital for Children at St. Tammany Parish Hospital. Ochsner brings a level of specialty care, primary care, and inpatient care into our partnership that helps us round out that comprehensive health system along the I-12 corridor.
Yes, I'm happy to do that. First, let me talk about our general pediatrics practice. We have 3 general pediatric practices located within St. Tammany Parish. That's a part of the partnership. We have St. Tammany's practice in Madisonville, and then Ochsner has 2 practices, one in Mandeville and one in Covington. So we pretty much cover the geography of West St. Tammany Parish with our general pediatric practices. All of the practices treat patients from birth to about 18 years of age, provide same day and next day access, and certainly are accepting new patients as well.
Outstanding. So that's certainly most of us as parents find ourselves interacting with pediatric care at that primary level. But sometimes children need highly specialized care, and those pediatricians may want to refer a patient into a multi-specialty clinic. And Ochsner Hospital for Children has a multi-specialty pediatric clinic in Covington as part of our system together. Tell us a little bit about what's available at that specialty clinic.
Yes, I'm happy to do that. Our Peds Subspecialty Clinic is located on Highway 21 in Covington, and it provides a whole host of subspecialty pediatric care that the community hasn't had previously. So some of the services include cardiology, pediatric cardiology, ENT, endocrinology. We also have pediatric oncology, hematology oncology, general surgery, and plastic surgery, orthopedics, pulmonology, and urology. So you can see we pretty much cover the gamut when it comes to this ped subspecialty arena.
An overwhelming list, but I am thinking if you have a child who has a congenital heart disease or juvenile diabetes, or if there's an incident or an accident, to be able to know that you have that level of specialty care right in Covington. I think we probably have a lot of parents who are presently traveling long distances to see those kinds of specialists in the pediatric specialty area.
Yes, that is what has been happening in the past. So adding these ped subspecialty services to the community is a response to the community asking for this level of care. So we're able to keep patients closer to home. And not only can patients be referred to the ped subspecialty clinic from local pediatricians or our pediatricians, but also we accept patient self-referrals as well. So it's easy to access this level of care right here in St. Tammany Parish.
Outstanding. Okay. Well, and you could talk a little bit, we've talked about the primary care pediatrics and about specialty pediatrics. Those are both on the outpatient side. Another aspect, and we talked a little bit with Cindy about this, is rehabilitation. And certainly the therapy and wellness facility with the pediatric certified speech therapy, physical therapy, and occupational therapy is really helpful to parents. But Ochsner Hospital for Children brings a special aspect from the Bow Center for Child Development. Here in Covington, there's a small piece of the Bow Center called Live Oak. Can you tell us a little bit about Live Oak?
Yes, Live Oak is a hidden gem in this community, and it's not really well known. But what Live Oak brings to the community is some very specialized therapeutic care for our special needs children. They are dedicated to helping children with developmental disorders overcome their challenges through intensive and comprehensive team-based care and integrated treatment protocols. They are committed to helping these children fully develop to the best of their potential and use the unique talents that they have. Okay,
so maybe a little bit different from for example, a pediatric physical therapy. You might be doing some play therapy to help that child regain range of motion after an accident, or possibly there's some occupational therapy to help a child who's developmentally delayed with fine motor skills. But at the Bow Center or Live Oak here in Covington, you might have a child who has behavioral challenges that maybe even impede that ability to do physical therapy. And so at the Live Oak Center, they're able to take those behavioral and physical training together to work intensively with those special needs children.
That is true. And they also will be a resource and support within the school system as well. So children that are having maybe some educational difficulties or challenges in the classroom, they are able to connect with the schools, the teachers, the parents, and really all together come up with a plan that will help that child overcome some of those challenges.
Wonderful. And in St. Tammany Parish, where 18% of public school children have special needs, this is really a resource for parents to not have to cross the lake or state lines for care.
That is true, and we're happy to have this resource available to the community.
Outstanding. Well, we talk about using the name Ochsner Hospital for Children at St. Tammany Parish Hospital, and the idea behind that is to really show that level of specialty care that we're able to bring together, and I think that's an excellent example. You have the Live Oak Center, you have therapy and wellness with pediatric certified therapists, you have primary pediatrics in Madisonville, Mandeville, and Covington. We have the specialty care that you talked about, the pediatric multi-specialty clinic that has, I think, every level of pediatric specialty in there. That was quite a list you gave us. And then Cindy, of course, talked about your Ochsner Hospital for Children pediatric intensivists who are in our pediatric ICU and our pediatric inpatient unit, and how they coordinate with the pediatric emergency department 24/7, 365 downstairs. It's no wonder we're saying the most comprehensive health system for children along the I-12 corridor.
That's right, and we're proud to be able to offer this to our community. Like I said earlier, it was a response to what the community was telling us we needed to provide as healthcare, from the healthcare perspective here. And so we're happy to have partnered and accomplish that.
And we're excited too, from a St. Tammany Parish Hospital perspective. Our mission from the time we were founded in 1954 was to see to it that the care people who lived here needed was available to them close to home. And over the decades, as our parish has grown, become less rural and more suburban, our hospital has also grown. And 5 years ago, we forged our partnership with Ochsner Health System to recognize that we needed a larger organization to help us bring a level of specialty care that we really were not able to bring into the market alone. So we are excited to have Ochsner Hospital for Children at St. Tammany Parish Hospital in the 5th year of our partnership between the two organizations.
Yes, that's right.
Melissa, thank you so much for coming to join us today. We've been talking with Melissa O'Malley of Ochsner Health System, Cindy Ingram of St. Tammany Parish Hospital, and next we'll talk with Lori Cage of the Parenting Center. Together, they're talking about the most comprehensive health system for children along the I-12 corridor, Ochsner Hospital for Children at St. Tammany Parish Hospital. We'll be right back.